Thank you so much for bringing your animal to get spayed or neutered today. So we're going to go over a few little helpful hints to help take care of your little critter for the next few days. So major surgery has been done on these little guys, and they do recover really quick, but they do require a little bit more attention than normal. So we'll go over some aftercare instructions and just to make sure that they stay nice and healthy. So surgery is done. Now you're going to pick up your little guy. And so here's the e-collar. E-collar is very important. This e-collar must go on and kind of tie it behind the back here, and you're going to place 2 fingers underneath when you tie it, and that way it doesn't slide off. Make sure you can slide 2 fingers underneath. You want a nice fit, and you want to make sure that the nose does not go past the e-collar. This e-collar is very important. It stays on for the next 10 to 14 days. Okay, you can take it off if they're not eating, but make sure you put it right back on. We don't want that surgery site to get ruined. Okay, so you're bringing your baby home right after surgery. So much has happened today, so now we want to make sure that we give them time to recover. So no running, no jumping, taking them outside for potty breaks, just take them out, bring them back in. Make sure that their surgery site keeps dry. Maybe keep them calm, keep them in a nice quiet area, give them their quiet time. Maybe away from kids and not so rowdy the first day. Give them time to recover. Cats, definitely, if they're outdoor cats, make sure that they do not go outdoors, and if they do, make sure that you take the e-collars off. We don't want a cat outdoors with an e-collar. Keep female dogs away from male dogs for the next 10 to 14 days because of their surgery. They can have internal damage. But again, limit exercise to take for minimal walks just to go to potty breaks because we don't want that tissue to get irritated and swelling. Okay, so now it's their first meal. They've just had surgery, their tummy's really upset, they've had a lot going on today. So generally they already have their e-collar. When you pick them up, they're gonna have their e-collar on. So you can just take it off gently. And you can offer a small amount of food. Make sure you don't change the diet because, like I said, their stomach is really irritated. Offer a small amount of water at first. If they keep that down, you can offer a small amount of food. Again, sometimes with the e-collar on, they don't like to eat, so you can take that off just to try to get them to eat. Don't give them any table scraps, don't give them anything different because, again, that's going to upset their stomach and it can cause nausea and vomiting and diarrhea. So just have them stick to the normal diet. If they're not eating within the next 24 hours, definitely give us a call back and you'll find our number on the sheet. Okay, so we're back again. So now your animal has had surgery today, and now you want to know what normal surgery site looks like. This little guy was done today, and we'll take a look at his surgery site. So here is our surgery site. This looks really good. Sometimes I'll have just a little bit of bruising around the incision, females as well. And so just make sure that you keep this dry for the next 10 to 14 days. No swimming, no bathing, and make sure you don't put any peroxide or alcohol or anything on there to disinfect it. If there is swelling or there is any oozing, definitely give us a call back and we can take a look at it and you can bring them in. Again, just make sure this e-collar stays on. There are no sutures, so you don't have to return for a suture removal. But again, just limit your exercise. Can't stress that enough, and make sure that this e-collar stays on, that there's no licking at the site. Hi there, so if you've adopted a female from us, you'll notice a little something extra on their belly. So generally we put a little tattoo on there just to signify that they've already been altered or spayed. So again, if you look on their belly and you see a little something, don't worry about it, it's just a little heart and just gonna be there forever, it doesn't wash away. There you go. Okay, pain medication. So pain is really important after surgery. We want to make sure that we take care of pain. They recover a lot faster. So we have already given some pain medication here today during surgery. We are going to send some medication home with you guys today. So this is not to be started until the day following surgery. So instructions have been printed on the label, and just make sure you follow them. Pain medication is what we use here is carprofen, also called Rimadyl. So make sure that this is what you give. You can give it in a meatball of a little bit of cheese, a little bit of hot dog or something like that, just to make sure that they do eat it. Make sure, very, very important, that no Tylenol or ibuprofen is given to them. Those are both toxic for your pet and can cause a lot of problems. So if you have any questions for the next 2 days following surgery, pain medication will be provided for you.